World Health Organization says there's been a fourfold increase in diabetes in the past 4 decades.
The study indicates more than half of all Americans either have the disease or a condition that leads to it.
Do you think that the UK takes diabetes seriously?
Unfortunately not, and especially a story of type 2 diabetes.
Does anyone know what diabetes is?
Yes, it's a disease that... Too much sugar?
It's not as simple as saying that sugar or sugarcane causes diabetes. The answer is, of course, always more complex.
Some people generalize and they think that by cutting down on my sugar and diet, I'm doing the right things. They don't really get the simple information that it's about the bread and the rice and the potatoes and the pasta and the pizzas and the cakes, even without a sprinkle of sugar.
It's estimated that in the United Kingdom, £1 million is being spent every hour, and across the year that equates to £24 billion.
The average Joe taxpayer has no idea how much their tax dollars are going to support trying to treat this condition.
Often when people die, diabetes is not listed as the cause, and yet it is the cause of the renal failure or the heart disease or something else that it has triggered.
You know, I sit in the diabetic clinic and I see a succession of patients and I'm thinking, this isn't a condition that I should be treating. This is a condition that actually the Ministry of Education have to do. We have to change the culture of our nation, and that's true for every country in the world if we're going to really make a difference.
It should scare health ministers, just as a runaway epidemic of HIV or high prevalence of HIV and ongoing new cases should scare health ministers. So should the diabetes epidemic.
It's not a big surprise that the diabetes epidemic is paralleling the obesity epidemic. So for most people with type 2 diabetes, it's not a sugar disease, even though that's all we talk about. It's a consumption disease.
A normal human in our culture eats around 8 to 10 times a day. If you give the same amount of calories either in 2 or 3 meals or in 6 or 7, you can induce much more fatty liver, for instance, with even the same type of food.
If you look, for example, at the Pacific today, 7 Pacific countries are in the 10 countries with the highest rates of obesity in the world. We know what that means for diabetes.
I think the average age of coronary heart disease has gone even below 50.
The more that you eat, the more that you become. And the more that you become, the more value you have as a physical body.
Actually changing the culture will make the main difference. So it's a combination of eating the wrong things but within an environment which fosters it.
We are currently growing 400 calories a day, more than we were 30 years ago. And as a consequence, we're consuming that food and putting on weight.
We are quickly transitioning from a problem of lack of food to a problem of obesity, and right now we are in the midst of both. So that's the interesting thing about India. You have starvation coexisting with overnutrition.
One on 3 people of the age of 30 would have diabetes, and 1 of 2 people over the age of 70 or 65 would have diabetes.
It's just too hot. Where do you do your physical activity? Everybody's inside in air-conditioned, driving around in air-conditioned cars. And so the challenges are huge in the UK, but I guess they're even greater in many of the countries where diabetes is so common.
For a Western person watching this, it's like saying Christmas. But the only difference is Christmas is 1 or 2 days. Ramadan is a full month.
Whilst the number of people in the Middle East with diabetes is extremely high, in reality it's both high for the local population of Arabs as well as the migrant population, which are predominantly from Southeast Asia. Is your perception that it's more common in Western countries, in developed countries, or more common in developing countries?
I know it happens quite a lot in developed countries, but I'll be honest, I don't know about emerging countries because it's not really reported.
The fundamental problem is the foods that they eat. And it's not so much the quantities, but it's the quantities for their genetic predisposition for the people that they are.
Indians are built small, but they have diabetes at lower levels of obesity as compared to the West.
They found that really diabetes is fueling tuberculosis in India.
500 million Chinese people are affected by either diabetes or 3 stages to diabetes.
The diabetes and other chronic illness is going to just put so much burden to the economy as well as to the individuals and the household.
They have an enormous problem which require really focused efforts to change that curve.
Think of a single condition. You can think of every disease you've ever learned of, which asks more of the person in terms of self-managing that condition.
Just 90 years ago, if you were diagnosed with type 1 diabetes, it meant certain death. And in a moment, with the discovery of insulin, it meant life.
People are walking along this tightrope with high blood sugar levels on one side and low blood sugar levels, what people colloquially called hypos, on the other side. One side of the tightrope, if you like, is a long-term hazard and risk. So these are complications that may be 10, 20, 30 years down the track.
What we now understand is that a period of very good control, a period where you actually make an effort and get things under control, that can provide benefit that lasts for decades.
And then there's the other concern, fear, which is hypoglycemia, low blood sugar, which is immediate. This is something that might happen today or this afternoon or tomorrow or during the night, even worse.
If you think every meal, counting your carbs, working out your insulin dose, judging how much exercise you're going to do, and if you get it wrong, if you take too much insulin, you become hypoglycemic and go unconscious or crash your car. To do that every day of your whole life, I just think is awesome.